As promised, we're going to subject our bright ideas to rigorous scrutiny as we try to determine whether we can bring our idea along into a completed research project. Through a series of questions, you're going to ascertain whether you have an adequate environment to allow your idea to succeed, and also help you understand what it's going to cost. By the end, you should have the tools to assess feasibility and to formulate a reasonable and realistic budget. Lemon detecting is a critical research skill, and one that doesn't get nearly enough attention. This is what saves you and your team a world of pain, and potentially saves your reputation as a solid and productive researcher. Here follows 6 important questions. We'll unpack each of these, but if you can satisfactorily answer all of these issues, you're almost ready to commit to your project. How many subjects or specimens do you need? How many subjects and specimens do you have access to over your intended study period? Do you have access to the necessary personnel, necessary materials, necessary expertise, and can you satisfy your regulatory stakeholders? This is a question that depends on what you're doing. It depends on your primary outcome measure, how much statistical power you want, and what your loss to follow-up is expected to be. We'll come back to the notion of power and sample size, because this is an FAQ for statistical consultation, but it's really not magical. You just need to have an answer to each of the 4 boxes on the right-hand side. Loss to follow-up is in bold because for whatever reason, researchers are crazy optimists on this front. More than one study has been brought low because loss to follow-up was much higher than anticipated. The immediate follow-up question is whether you can actually access the number of subjects you need. Patient flow, number of physicians recruiting, number of sites, local and general epidemiology, inclusion-exclusion criteria are all strong influences on this. A focused practice audit or record search can help you get a sense of the number of potentially eligible patients during a given time period. Regardless of how many that number is, it is almost always lower than what the PI thinks it is, a prime example of recall bias. You can also get a sense of potential loss to follow-up by auditing how many patients disappear from a practice before the end of your proposed follow-up period. A current project of mine has an expected loss to follow-up of 30%, and that's based on a real-life count. This one doesn't always get a lot of thought. First, you need to decide on the research team and who you'll need. Second, and more importantly, does each member of the team have the necessary time and ability to fill the role expectations for the study? Research is time and energy consuming, and each member of the team, perhaps including and especially the PI, needs to commit to doing good work in a timely fashion. If you're that strapped for time, the better answer may be to delay starting, or to leave the idea for someone better positioned to carry it out. We're now moving into the literal nuts and bolts. You need to consider the instruments that you'll use to collect your data and the media on which they're presented to the study subjects. You'll need to consider data storage, and certainly for any live human research, this is a really important issue as multiple legal and regulatory standards exist. Analysis of the data can be done by a team member, or it may need to be contracted out. You also need to think about what will be needed to translate your work appropriately. Finally, you need to think about things like office supplies, postal charges, and physical space. We've alluded to this already, but you need the right brains in order to make your project work. This could be other physicians if your idea is collaborative, it could be allied health practitioners, or it could be a study design expert, knowledge translation expert, or statistician. If your study requires specialized equipment, you may need to ensure access to adequate technical support. In order for a study to be feasible, it has to stand up to the regulatory standards of the university, the Health Service, and Health Canada. Not all studies require direct Health Canada approval, but if you intend to use a device or pharmaceutical in a novel way, you most likely will. Being unable to satisfactorily mitigate risks to participants will mean trouble from the Ethics Review Board. Finally, one of your most important stakeholders are your study participants. If what you want them to do is onerous, they will either not enroll or they will drop out in high numbers. If you're at the end of the feasibility checklist and your study is still looking good, the final checkpoint is the cost, and obviously whether that cost is manageable. In clinical research, having a research assistant is often a critical role. You can budget in one of 2 ways. The first is a per patient time, while the second is a fraction of a 40-hour work week. The per patient time will depend widely on the study and on whether the research assistant will also have to clean and enter the data. For example, a single-page self-reported questionnaire in young, healthy, educated patients will require little supervision. A multi-page form in a hip fracture population may require significant supervision and assistance for the patient. Either way, in 2017 prices, an entry-level full-time research assistant costs about $50,000 salary and benefits per year, while an experienced or value-added assistant could run $80,000 to $90,000 per year. Summer students must receive a minimum of $15 per hour as per the CIHR. Not all outcome questionnaires are free. Some have licensing fees per year, per use, or per flat rate. This may influence your decision-making if you have several viable options. Licensing fees could run into a couple of $1,000s depending on your study. If you plan to use paper forms, you'll need paper and ink. If you plan to do direct electronic entry, you'll need access to devices. If you're planning to use investigations or treatments beyond the standard of care, the health service may require you to pay for the additional investigations. How you store data, especially from human research, is very important. The Ethics Board will have you justify every identifier that you collect. A proper database program is also important for efficient and organized data storage. The good news is that REDCap is available at the U of C, and this program has the capability to address a lot of these issues. A de-identified database is a cost-effective approach and easy to learn to use. Databases do need to be maintained, and this needs to be planned for. If you're not in a position to build your own database, you'll have to pay for this service. Considerations will depend on your institution, but the U of C mandates secure storage of research records for 5 years after study completion, followed by secure destruction. There's a per box charge for this and will depend on the total quantity of physical material. You'll need to decide when a statistician should be involved, early and/or late in the process. While some studies have pretty straightforward analyses, you'd at least need software to run stats if you want to do it yourself. For statisticians, most will want a per-hour rate, while some may elect for alternative compensation schemes. Cheapest is not always best, though. This is going to depend on what your KT goals are. However, even peer-reviewed publication has costs these days. Check with your institution, because some will pay for open access fees if you get accepted. Also, if one of your team is a society member, fees may be greatly reduced or waived for society journals. Going to conferences, printing posters, and coffee and muffins for rounds are all knowledge translation costs. Finally, miscellaneous costs such as summer student salaries, equipment replacement, and administration fees need to be factored. At the University of Calgary, funding from external industry sources is subject to a pretty hefty admin fee that could be up to 25%, and you need to be aware of that. So what if you're broke? Well, you've got some choices to make. Can you simplify your design? Can you leverage your existing funds? Can you get some of it covered through in-kind contributions? Are you in a position to piggyback on a larger group? If you've turned over all the rocks and all you have is woodlice, you might have to abandon or postpone the study. Funding is a fundamental part of feasibility and may be the final determinant of whether your idea can be done by you. Running out of money halfway is not a good situation and is one of waste and frustration. So now you've got a roadmap for assessing feasibility and creating your budget. Believe it or not, this is the level of detail required for things like the CHREB. Ultimately, if you can't resolve the feasibility issues, a lemon has been detected. Now run away from it. Assessing feasibility is a critical step and avoids pointless expenditure of time and resources. Having a sense of the costs involved helps the research team make sensible design decisions and avoid nasty surprises. In the next podcast, we'll take a brief look at the new field of knowledge translation.